Hi, my name is Tom King and I'm an assistant psychologist working at Sheffield Children's Hospital. Today I'm going to talk to you about some of the group interventions that we offer within our service that you might be invited to. Most people who are referred to the Paediatric psychology department will be offered a group to start with, which takes place over several weeks. There is normally a short wait for these groups to begin. At the end of the group, you'll be offered a one-to-one review call with a clinician to review the group work, as well as explore if further support would be beneficial. Sometimes people can feel quite nervous about attending a group as they're not sure what to expect, and that's okay. We want to give you a bit more information about what groups we offer and what to expect to try and make this feel a little bit easier. We know that some people who are accessing Sheffield Children's Hospital may be struggling with some of their thoughts, feelings and emotions in relation to their physical health. To help with these thoughts and feelings, we run groups for young people and for parents and carers to try and help you think about these experiences and find some ways to manage them, as well as try and make attending the hospital a little easier if we can. Group interventions in psychology are a really good way of getting lots of clear information about your emotions and strategies to support your mental health. We also know that it can be a good opportunity to meet other people who might be having similar experiences to you. Currently, we run groups around low mood and anxiety for young people who have long-term health conditions. We also have groups for people with worries around procedures such as having needles or injections, and a group for parents and carers around supporting a child with a long-term condition. All our groups are run by assistant psychologists within the team and supported by a clinical psychologist, cognitive behavioural therapist or family therapist to make sure that we're giving you the most up-to-date, tried and tested and useful information. We try to make sure that the people in your group will be of a similar age to you, and we make sure that there are not too many people in the group. We will always work to make sure that the groups are a safe place and that everyone is treated with respect. You can choose to share as much or as little as you want, either through the microphone or by text. We do encourage people to take part, but we would never ask you directly as an individual. We would only ever ask the group as a whole. And if you don't feel like you can answer there and then, that's okay. We keep all information from the group within the group. The only time this would change would be if you or someone else was at risk of getting hurt, and then we would need to share this with people who can keep you safe. The groups run for several sessions, and these are all held virtually via Microsoft Teams. This is an app you might have used before, but it can easily be downloaded to a phone, tablet or laptop. We ask that people have their cameras on so that we know who is attending and know that it is safe, but it's okay if you don't want to use the microphone at first, and it's fine to use the text chat function to answer questions or share thoughts and ideas. We know that this can be a little scary, so if you have worries about accessing the group, then please let us know and we will do our best to work with you and find a way to make this easier. The children, young people and carers who have attended these groups in the past have always provided positive feedback, such as enjoying meeting other young people with long-term conditions, or that it has been good to hear from people with similar worries or concerns as them. And we welcome any suggestions as to how we can change or improve our groups to make them more accessible. Thank you for listening to this video, and we are here to support you should you need it.